Chairman, thank you. Secretary, welcome back to the committee. You and I have had many opportunities to talk about IHS funding, and I appreciate your trip to Alaska last year, very targeted on what we are doing with regards to health care for Alaska Natives as well as American Indians, Native Hawaiians. So I appreciate what we're seeing with the advanced appropriations for IHS in the budget. This really helps with providing certainty to our tribal health systems. So that's a good. Another good is the billion-dollar increase, including critical investments in IHS, health, IT, and the hospital oversight. So good there. Where I do have concerns is the reduction that we're seeing in the sanitation facilities construction account. This is an 87% cut. And you have had an opportunity on your visits to Alaska to see what it means when you have communities that don't have running water, that don't have clean drinking water, that don't have sanitation facilities and are using honey buckets. So we've made some good headway under the infrastructure law, but that was intended to supplement, not supplant, our annual appropriations. So I just want to make sure that you are committing on behalf of your folks within IHS to maintain a key eye on funding for tribal sanitation facilities construction. We're going to work, I'm certainly going to work on my side on the Appropriations Committee, but also as Chairman of the Indian Affairs to make sure that we don't go backwards on these important investments in basic sanitation for people in remote areas.
Absolutely. If that, we had to get cuts across the department. IHS was protected from those cuts. Yeah. They received $1 billion for infrastructure. Nobody else, I don't know, across the government has received that except maybe the Defense Department. I've made more visits to Indian country than any HHS secretary in history. And if, we don't like to make any of these cuts, it's up to Congress ultimately. If you appropriate the money, I, of course, will spend it.
Well, and know that we want to work with you to make wise investments. But again, when we think about those areas where we see just really dispiriting health outcomes in rural areas, so much of it can be traced back to they don't have access to basic clean water and sanitation. So we want to work with you on that. Last year, I had a chance to raise with you the LIHEAP program, the Low Income Home Energy Assistance Program. We have had a pretty tough winter. I was in Fairbanks over the weekend, and I was reminded that they had 152 consecutive days of temperatures below zero. 152 is a long time to be cold. And so this is where I look at LIHEAP, and it's not just kind of a nice to have, but for so many, it was very imperative. So I'm worried again that that LIHEAP funding is not made a priority. Last April, you eliminated all staff assigned to administer LIHEAP. It's my understanding now that responsibility for administering the entire program rests with a single staff member. I really hope that that is not accurate, but we need to know that not only these levels of important support are going to continue, but that there is adequate staffing to help address this. And I think particularly, it's not just cold winters that we faced, but now all of our families are seeing increased prices when it comes to home heating fuel. So many of our communities are diesel-powered communities, and the price of diesel is going to be shockingly high when that first spring barge comes in June. So I'm just asking for your help once again. I know you understand the priority of LIHEAP, but I'm putting it back on your radar.
And I spent all 90% of the money that I could spend. We've now gotten the last 10% released, and we will spend that. So we have adequate staffing to do that, and you know how I feel about that program.
Well, again, I'm just putting it back on your radar. I've got 20 seconds to just raise my concerns about the programs focused on domestic violence and sexual assault program. You have combined into a single program under the Administration for Healthy America. This is the Delta program and the RPE, the Rape Prevention and Education. I'm concerned that the programs aren't interchangeable. They serve distinct populations, different models, administered through fundamentally different structures, but I'm concerned that we're looking at nearly half the funding for programs that have a really proven record of improving public safety, reducing crime, and protecting victims of domestic violence and sexual assault. So again, I know it's a priority of yours, certainly a priority of mine, that we have effective tools when we're talking about prevention of domestic and sexual violence.
Thank you, Senator.
Thank you. Thank you, Mr. Chairman.
Support journalism you trust. Support PBS News. Donate now, or even better, start a monthly contribution today.